It is something we have been dealing with for 9 months, a pandemic like many of us have never seen before, and one we will likely be dealing with the after effects of for months, if not years to come.
Yeah, the mask wearing and social distancing have put strains on all of us in ways we may and may not recognize. Apart from families and loved ones, restaurants and bars close. So many of the things we would normally enjoy have been severely restricted.
The medicinal strains of a pandemic have been evident, but what this has meant for our peace of mind, for our relationship with our higher power. Tonight, in the final of our 3 episodes in partnership with Trinity University, we look at medicine, spirituality, and mental health during a pandemic. The help of a vaccine, some of us may have to wait for, but help for others, available now, and maybe just as important.
We want to introduce now our esteemed panel of experts who will be guiding us and walking us through this live stream. From top to bottom here, we have Dr. Charisse Rohr-Allegrini. She is a local epidemiologist and CEO of the San Antonio AIDS Foundation.
Dr. Lori Kinkler is the psychologist with counseling services at Trinity University.
Reverend Alex Serna-Wallender, chaplain of Trinity University.
And Dr. Jose Plata, who is a doctor at Trinity University. Thank you all for being with us. And like I told you when we were off camera, you know, if there's something you guys want to chime in on a particular subject, this is all open. And I want to make sure that people who are watching us on both the Trinity website as well as KSAT.com know that you are also welcome to chime in and send us your questions. We'll make sure that they get to our panel of experts. I want to start with you, Dr. Kinkler, if I could. Are you worried, you know, we talked about while we were doing this on air and online about the fact that a lot of students you're seeing are just in survival mode. And I think that's probably not just exclusive to students. I mean, I think a lot of us are in survival mode right now. What are the dangers of staying in survival mode and not acknowledging the stress and strain that a lot of us have been under?
Gosh, that's such a good question. You've already kind of led the answer there, because I am very worried about that. I think that in a way we are experiencing a prolonged trauma. You know, a trauma is when you experience a fear of your own life or well-being or the fear of a loved one's life or well-being. And so in some ways we're very much feeling that for ourselves and our loved ones. And it's hard to stop and think about that. Sometimes it's really hard to confront that fear and that pain and that sadness and that loss. And, you know, the more that we don't confront it, the more that we avoid it, the more that we're just kind of delaying the inevitable, just stuffing it down. And so my concern is that we're not seeing the worst of mental health issues right now. I think that we're going to see the worst of mental health issues once this feels like it's in the rear view mirror, because then we're going to slow down and actually have time to process what we have been going through or what we went through. And it's a scary thing. It's kind of like we're living in a movie. And so I think the folks who are faring best mental health wise are the folks who are engaging in reflection and not avoiding those difficult feelings and talking about the loss and the pain and the fear, either with themselves or with someone else. And so I think that would be some advice for what we can do now to help ourselves later.
Now, Dr. Kinkler, you just mentioned the loss, and Reverend, right during our 6 o'clock broadcast, you also mentioned the word grief, and I want to talk a little bit about those two things, loss and grief. You know, some have experienced loss through the death of someone, others have experienced that through the loss of a job. There's also the loss of freedoms to do the things that we used to. Reverend, what are some of the coping mechanisms to help us kind of navigate through this time that we're in?
I think, you know, especially as we approach the holiday season for a number of traditions, there becomes this tension between lament, grief, and sadness, and what we think we should be feeling, joy, celebration, even if it is different. And so I think one of the main things is to first, as Dr. Kinkler was saying, is to be willing to name and be able to name the loss, to take time to reflect and sort of really put into words that which you are grieving, that which you have lost, be it a loved one, be it a tradition, be it a way of being, be it an opportunity that didn't come to fruition. I think a second part of that, and similar to what Dr. Kinkler was saying, is to really give yourself permission to grieve, to be sad, to give yourself and others permission to feel that way, and to be honest with yourself, with those in your community about that sense of loss and grief. I think a third part of that is also recognizing that the worst grief is someone's own, and that we don't gain a lot by judging how others are encountering their grief. And so being willing to come alongside others in the ways that they are grieving in the moment, I think, is really key. And then I think a fourth piece is sort of find a way to help make tangible grief. A lot of our ways of grieving, our rituals of mourning, from funerals to wakes to memorial services, have either been reordered or taken away or put on pause. And so finding an opportunity, be it in a small, even familial way, to make tangible that, what you're holding inside, and give it release, I think can be a really helpful key piece to the grieving process.
Very well put.
Very insightful, yeah.
Yeah, thank you. I have a question for our two medical experts. When you talk about COVID fatigue and you mix that with the fact that we have a vaccine and hopefully soon 2 vaccines out there, how concerned are you, and I'll start with you, Spriester-Allegrini, Dr. Spriester-Allegrini, how concerned are you about people letting their guards down now and around Christmas time and around New Year's?
I'm extremely concerned. I've already heard people say, as soon as I get that vaccine, I'm taking the mask off. And I say, please don't. No, the Swiss cheese model has been popular, and that's the multiple layers of protection. We need to keep up with that. And I've been telling everyone, if you get the vaccine, the vaccine's not perfect. We still don't know how well it's going to protect against transmission. We need to continue wearing the mask. We need to continue all the precautions we're taking. But I am really worried about that. I think we need to do a better job at really communicating the need to stay on top of all the precautions that we've been doing for the last 6 or 8 months, and continue them for another 6 months until we're sure that we're in a better place with this virus.
Dr. Plata?
Trust me, I'm the first one that wants to be out there on the Riverwalk drinking a margarita. After a long
Add
day
me
at
to that
work,
list, yeah.
or for a Christmas or a big family gathering. But she's absolutely right. We can submit ourselves to temptation. As tempting as it is, the vaccine, even if you get it, it's a 2-part series. The first one's only 50% effective. You still have to wait 3 to 4 weeks to get the second one to get to that 90% effective rate. So just getting the vaccine is not going to guarantee you're not going to get COVID right away. So don't fall into temptation. We can always have margaritas 6 months from now.
Yeah, absolutely. All 6 of us. We'll go down to the river and we'll have some margaritas when this gets behind us.
Yes. Sticking with our medical experts here, during the briefing today, there was a statistic thrown out that just floored me. It just floored me. Something like 91% of the cases that we're seeing right now are actually happening in households. I think traditionally we have thought of them as happening in restaurants and bars. I'm someone who doesn't hardly go out, and so I never thought, that never dawned on me, that it would be happening at such a humongous rate inside the household. What do you say to that as people are making that decision right now, whether or not to see their loved one for Christmas? I know it was really difficult for me to tell my dad, sorry, Dad, we can't get together this time around.
So absolutely, this is such a huge issue, and we've been talking about it for many months. It's easy to focus on bars and restaurants. I'm not sure why they're such an easy target, because we take off our masks to eat and drink. The thing is, in those places, we're separate from other groups. We're with the people that we came with. Those are the same people we tend to be in the same household with, or whom we will share a meal with in a private setting. And the thing is, in our private households, we're not taking precautions. I've been at a couple of outdoor events now where people have worn a mask throughout. they have a drink with them, they take the mask off briefly to take a sip of the drink and put the mask back on. That's been because, people are watching, it's in public, that's what you need to do. But when you're in a household with your friends, you're not going to follow those precautions. And it's difficult to isolate within a house. And so when you bring another family or another group of friends into that private space, you relax all your precautions. And that's why the risk of infection is so much greater in that kind of situation.
Dr. Plata, are you surprised at that statistic where, almost 92% of the cases in Bexar County are coming from close contacts?
Not at all. We're human. We crave that human interaction. There's friends who want to gather. There's loved ones that we want to see. Even from a medical perspective, we want to be next to our parents, next to our brothers, sisters, and children to take care of them when they're sick with COVID. So she's exactly correct. That's when we drop our guard, the masks are off. That's how my grandma got COVID. She went and hugged my aunt who had just been with my cousin who's a nurse. So, my grandma has left the house 0 times since January, February. So that's exactly how we're catching it. We're human, we like interaction, and we let our guards down to people who we would never think would harm us. And they're not doing it on purpose. It's unwanted, but that's how the virus is transmitted. It's an invisible danger we don't see.
Yeah, this is probably a good time to point out as well that you contracted COVID-19 as well, correct?
Correct, and it's exactly that. I let my guard down and let individuals who are outside my direct bubble into the household. So that's exactly how it happened, and here we are. It's being repeated all over the city.
Dr. Plata, we just got a viewer question come in for you specifically, and I want to give you a chance to clarify. They're asking about the 2 shots of the vaccine. When will we be safe? We do need the 2 shots, correct, to make the vaccine effective?
To reach the maximum efficacy, you need the 2-part series. Now, that's specifically for Pfizer and Moderna. There are other vaccines under development. There are a single-shot series, but those are still 3 to 6 months from being released to the general public.
Dr. Ruralagrini, but even if you get these 2 shots, it's not, you said it's not time to take my mask off and go celebrate.
Right. So what we don't know yet, and we're really hopeful about this, but the vaccines that we've been studying and are using help to protect against severe disease. So with other vaccines, like for example, measles, the vaccine also protects against transmission. We're hoping that's going to be the case with these COVID-19 vaccines, but the data really aren't there yet. We have some preliminary data, so it's probable. But that's important because while it helps to protect you from getting very ill, you could still potentially transmit the virus. And so that's why it's going to be important to continue your mask wearing, continue your physical distancing, and staying outside. Hopefully, the vaccine will protect against transmission, but we're not there yet.
Dr. Kinkler, I want to bring you in on this because we talked off the top about the fact that there are a lot of us that are just going to have to wait before we can get the vaccine. But there is help now for mental health, for mental and spiritual health. There is help out there right now, and I think we have a 1-800 number, if we can put that up, that people can call. It's the Mental Health Support, Texas Health and Human Services Mental Health Support Hotline that's up there right now. I want to talk to you about some ways that we can stay mentally healthy during the pandemic, especially during the holidays.
Right. So you mentioned that help is available now, and that's true. So some folks, really want to talk to a mental health professional, and in some ways now is a great time to do that because often there are transportation issues and motivation issues with actually getting to see a counselor, and it's a lot easier now because most counselors are meeting with folks virtually, and so you can speak with a counselor from the comfort of your home. And there are other services like, the text message therapy services that some people have great experiences with those and others don't like them. And I think I would just say, do whatever you feel like you can do and are willing to do, and whatever feels comfortable for you in the realm of getting counseling. But I think that there's a lot of other things that we can do to stay mentally healthy. I think routine is really important. Our brains really like a little bit of predictability, peppered with, some flexibility. You don't want to get so rigid that you're like, oh, 8 o'clock is my breakfast time and I'm not having breakfast. And so, the whole day is ruined, because life happens. And so you need to be a little bit flexible. And so that's why I say routine instead of schedule. But it's really nice to sort of say, okay, this is the time that I'm going to devote to maybe some spiritual reflection, and this is the time that I'm going to be focusing on exercise or moving my body, and this is the time that I'm going to be focusing on making connections, albeit virtually, and stuff like that. Give yourself something to follow and to look forward to. I do think that time for reflection is really important. In a way, counseling does that, but there's other ways that you can do that through gardening or painting, or really just, pouring yourself a cup of coffee and putting your phone away and sitting with yourself and kind of being with your thoughts. Certainly writing in a journal can do that for you as well. I think what also can be really helpful is giving yourself a project or a hobby that gives you sort of like a daily sense of purpose. Maybe not like an existential big life sense of purpose, but kind of like, this is something that I can attend to today, and look forward to tomorrow as well. So something like taking on a new pet, or planting a garden, or some sort of project that you can kind of get back to on a daily basis. And so those are some things that I think can help.
Those are great tips. You mentioned telehealth and telemedicine, and I want to ask you a little bit about that, because so many of these services have moved into a virtual realm. That face-to-face interaction, to me, is critical. Do you think it's as effective? And then we also had a question just come in for you, somebody asking about privacy. How can we ensure that privacy is happening when these are going virtual instead of face-to-face?
Yeah, those are great questions. I have to say, myself and my colleagues were very hesitant to enter into the telehealth world, because we value the face-to-face interaction, and there are some things that get lost, body language and whatnot, when you're meeting with someone virtually. But now that we've been doing it for a while, and I think we all kind of feel this way in a sense, it's become the new normal.
Yeah.
And I have been surprised at how in depth I'm able to go with my clients, and how much progress is able to be made despite the fact that we're talking to each other over a computer. And so I think, it's different, but I think it's still really valuable. In terms of privacy, there are many, many different HIPAA compliant platforms that clinicians are using now, same with the medical doctors, and so I'm sure they can speak to that as well. And with every mental health professional, there should be an informed consent process and a confidentiality statement, which needs to be talked about and signed prior to any sessions beginning. And so information about what platform is being used and the ways in which those platforms have safety precautions should be explicitly either talked about or at least mentioned in one's paperwork. And so we certainly, we here at Trinity Counseling Services, we use a HIPAA compliant platform, and most of the folks that I've spoken to in the community are very much committed to privacy issues.
We got another viewer question I want to give to you right now is, what do you say to people, whether it's a friend or a family member, who thinks getting help is a sign of weakness?
Yeah. Well, you have to be okay with that. I mean, a lot of times it happens within families, it happens within cultures, and you want to be respectful of that, if that's the way that someone feels, they're not going to be ready necessarily to open up, and that's okay. But there are other ways in which they can work on their own mental health, ways that they can reflect and process, again, some of the negative feelings that are happening as a result of this. And I think that the more that we can normalize help seeking, the more that stigma is going to go away. And so, I think one way that we can combat that is just being the person to say, hey, I need to talk to someone sometimes. I need help sometimes. I go to counseling. It helps me. And the more that people can hear that, the more that we can work on that stigma.
Yeah, an insidious stigma, really. Because to me, asking for help is a sign of strength. It's not a sign of weakness.
Definitely.
And speaking of that, we want to throw that graphic up one more time, that number to call if you feel like you need help, you want to give that number to someone else, 1-833-986-1919. That is the Texas Health and Human Services COVID-19 mental health support hotline. Reverend, I want to move the conversation to talk a little bit about spirituality. You know that the pandemic has changed everything, how we shop, how we interact, how we go to work, how we go to school. How has the pandemic changed the way that people practice their faith? And I'm not just talking about a tangible way like going to church, but how has it changed the relationships that we have in our faith communities? And do you think it's brought people closer to their respective faiths?
No, I think, as we talk about, everyone is on their own spiritual journey. And so for some, I think this has been a real time of reevaluating and reconnecting and digging deeper. I think there's also, it's hard to connect. One of the most beautiful things about some of our faith traditions is the sense of communal gathering. And sometimes communal gathering over Zoom is hard, and that is difficult. And I know a number of communities and congregations have found unique and creative ways to do that. And I think that has been, really important. I think in this holiday season, especially thinking about what does it look like for individual families to imagine anew what their celebrations and rituals will look like. I think that it's a creative time for them. So the sort of large services or big family gatherings that could have happened and that are potentially part of everyone's normal yearly sort of journey aren't. And so it's, how do you take a step back as a family and really talk about what is valuable to us in this season, and how do we want to mark that moment? Maybe it is developing sort of prayers as your own family, or your own ways of, maybe it's a hymn that you sing as a family together, or sort of small service that you do sort of family side, and sort of think about that. And I think also something Dr. Kinkler hit on earlier, and that I think we have seen a lot throughout this pandemic, is people reimagining what their daily spiritual practices look like. And I think it's important for them to sort of, think about how we give shape to those. Maybe it's a morning practice, like taking a morning prayer walk or meditation walk through their neighborhood. Maybe it's a midday practice of taking 15 minutes out of the middle of the day simply to not do anything, to rest, to be a midday Sabbath, as it were. Or maybe it's an evening practice. Carrie Newcomer has a beautiful poem called 3 Gratitudes. Basically, is an evening gratitude practice in poem form that I love. But Ignatius of Loyola also has a beautiful evening practice called the Examen, sort of looking back on your day. And I think what Dr. Kinkler was saying, these ways of shaping our days can be really helpful in thinking about how we invest in our spiritual lives as well. What are those touchstones, those moments of pausing, being, reconnecting with the divine? I think can be a really powerful and important thing in doing and thinking about how that develops individually, in the sense of, in this season, is all the more important.
How about important thing to remember, don't you think, in the hustle and bustle and the chaos of our day, just to take that moment to be still and reflect.
Well, and like you said, Reverend, you talked about the fact of being rooted. Our spirituality, for a lot of us, myself included, helps us stay rooted and humble and connected to something. Talk about the role, I'm curious too, about the role of empathy and forgiveness, especially in this time, for lack of a better word, giving people a wide berth in their emotions and what they choose to feel and not feel.
I think, that is so crucial. Something you were saying, Steve, reminded me. So Parker Palmer, who's a Quaker theologian, has this beautiful quote that basically is, self-care is never a selfish act. It is basically good stewardship of the only gift you have to give. And I think as we think about empathy and forgiveness and compassion for others, first it starts with empathy for ourselves and having self-compassion and recognizing the places where we maybe are falling short of where we would want to be, and giving ourselves grace in that. And when we're able to give ourselves grace in that, it gives us the opportunity to sort of be more gracious to others and how they are, encountering a pandemic for the first time. This is the first time any of us, or many of us, have ever really experienced loss and pain and trauma at this level. And so none of us are responding in the ways that we would want. And so the practice of having grace, of being forgiving, is, I think, key to how we encounter ourselves and encounter others in this moment.
Reverend, we just had a really important question come in for you, and I'm going to read it verbatim. It says, I feel like I don't know how to pray, but know I need to do something so that I can feel like I'm setting this stress aside. How can I learn to do this?
Yes, I think there's, oh gosh, that is such a beautiful question. And I think it's to start really is find a place to start. So for some, there's a prayer journals can be a really important thing. And so it is just, first thing in the morning, like what is that you're holding, and putting those words onto the page. They don't have to make sense. It's just like all of those things that you're holding, just writing those down and offering them as a prayer. There's another beautiful practice of single words, just like, what is my emotion? What am I feeling in this moment? Is it sadness? And just saying, and just sort of taking that word and like physically releasing it as an act of prayer. I think, there are a number of beautiful prayer resources online. I think there's also a beautiful text called Peace is Every Step by Thich Nhat Hanh, who is actually a Buddhist monk, but it has a number of these sort of centering prayer practices that can be really beautiful. So I think in essence, it's don't get caught in the way of doing it. Find something that feels meaningful to you in the moment and start there and just create an opening of release.
Yeah, the hardest step's usually the
from your
first
heart,
step. Yeah, and so I appreciated what you said there, where you said, just try it. If it's journaling, if it's actually kneeling and praying, just try it. I want to turn to Dr. Charisse or Allegrini. I said off the top, when we're talking about medicine and spirituality and mental health, they all kind of come together. I mean, I don't want to assume that that's correct. I mean, have you seen evidence that this is true?
I think they do all come together, and I think it's important for people to realize spirituality can mean a lot of different things. It doesn't necessarily mean religion, but sort of our need to meditate, our need to take some time to look inward. And I think they do all come together in this pandemic, partly because of perhaps loneliness and isolation. Just for myself, my life has gotten insanely busy in the last 10 months, but for a lot of people, they were forced into to being home and being more quiet, and that was a challenge. And so learning how to put all these things together has been learning for all of us. And for somebody like me whose professional life really picked up, I have to find different ways of finding that spirituality, finding that calmness and center in the midst of the insanity that's been the last year.
I want to stay with you, Dr. Allegrini. I saw a recent article that said 1 in 5 people diagnosed with COVID-19 will develop a psychiatric disorder within 3 months. What is known about how COVID-19 has affected the mental health of those who have survived the disease? Do we know much about that?
I might punt to Dr. Plata if
Okay.
he knows more. I've read a little bit about it. There's definitely some potential psychoses that have been associated with being infected with the virus, and they're just now studying that. And I can't say that I don't feel confident enough to really respond. I think as what happens with any significant event is there's some survivor's guilt. Certainly we see that with HIV. That's the world I work in now. Many of the folks who lost friends in the early years of the pandemic and who are thrilled to be still alive also suffer from depression related to a type of survivor's guilt. So I've read that that's an issue that's been involved as well. Maybe some of the other folks can add a little bit more on that.
Dr. Plata?
Yes, there is an absolute connection between our minds, our bodies, and our overall spirituality. We see that manifested in common diseases people have in our city. Low thyroid or hypothyroidism, a known manifestation is fatigue physically or depression from our mental perspective. Diseases get us depressed. From a personal side, a small study of just me and myself after I had COVID in June. I'm telling you, I went through medical school, through residency. I'm prior active duty Navy. I'm a physician. I have multiple layers to my life, and I never had any psychiatric conditions. But significantly within the month or two right after COVID hit me, I started having anxiety. And that's not who I am. I am able to perform at 100%, 110% all day. So to sit there and be anxious about talking to a patient, talking to a student, or talking to a colleague where in the past this wasn't a thing, it took me back and made me realize there's still some inflammation going on. Wow. So we know this virus gets our organs inflamed, leading to multiple things: chest pain, shortness of breath. We don't know the strokes. So we don't know if that depression, if that anxiety, is it because I had mini clots in certain areas of my brain that are now leading to this personality change? Or is it really just the inflammation from the virus itself? Or, as we're alluding to, is it the trauma of going through something like this and having some survivor's guilt, or more than likely all of the above?
Wow.
So there is definitely a connection. I don't want people out there to think that they're going quote unquote crazy or have a stigma of the psychiatric illness. Psychiatric disease can go anything from mild stress disorder to anxiety to depression. There's definitely a connection on it. There's still diseases out there we don't understand, like fibromyalgia. There's a mind-body connection to that disease process we're still trying to figure out, but it's real. People have pain, people have depression. And just because you can't see it with the naked eye doesn't mean it's not happening. Mm-hmm. So you're not alone out there and you can't go through with it. Just seek out help, please.
I love that message, Doctor. A viewer question is, I'm still busy and stressed out, and now during the holidays I'm feeling very anxious. Can this harm my immune system, making me more open to getting COVID?
Yes, from multiple layers, right? So again, if you're anxious, your guard's going to be down. You're going to invite people over to soothe you in your house. You're not going to wear your mask. You're going to be hugging. You're going to be kissing each other on the cheek. You're going to be watching Netflix together on the couch to kind of make things up. Going out on a fast food run, right? From the anxiety itself yes, anxiety makes us very, very sick. It makes us nauseous. It makes us not feel good. And it's going to give a lot of this inflammatory process that makes your body weak. In our elderly population, when your immune system goes down, a shingles outbreak happens. So with anxiety right now, your immune system is going to go down. You may be prone to cold, a flu, or worst case scenario, getting COVID, and not just a mild case, but a more moderate to severe case.
Dr. Kinkler, I want to ask you my next question. You know, historically, we've heard from many people that Christmas can be a hard time of the year. We hear about these Christmas blues. You know, it's not all jolly elves and candy canes for everybody. It is hard for a lot of people. And so how has COVID exacerbated that? So for some people, it's already a tough season. And how has COVID made that all the more worse?
Well, it's hard to say why people tend to get sadder during the holidays, but a lot of it has to do with an increase in kind of extended family interactions and kind of the sometimes there's issues and conflict and drama within that, and sometimes there's deeper level kind of just dynamics that make us feel things that we're not used to feeling or that we don't feel other times of the year. And so in some ways, COVID is, and staying home as a result of COVID excuses us from some of those interactions. But it's a double-edged sword because it also feels very weird not to be doing those things that we're so used to doing. Tradition feels really important. And so I think I would encourage folks to think really creatively about what is it that brings you joy during the holiday season. And I recognize that that's going to be really different for different people. Like, for some people, joy comes in feeling overwhelmed, like the rush of getting that last Barbie on the shelf, or orchestrating a 10-course meal for several people. But for some people, it's quieter things like, drinking hot chocolate and listening to certain Christmas holiday music or that sort of thing. And so I think it's important to just recognize what that is for you, and then think creatively about how you can still make that happen for yourself, despite these boundaries and these, issues that we're coming up against. So yes, obviously, meeting with family in a virtual way, it might be important, but there might be other things like making cookies that you would normally make and mailing them, or leaving them at people's doorstep. Little acts that make you feel that connectedness. You're still experiencing the giving of the holiday season, just in a different way.
One of our viewer questions: can depression be causing us to be more impatient and maybe bickering with our loved ones more? Everybody nods their head.
Yes, irritability is a aspect, it is a symptom of depression. But I would say that also happens when you're just stuck with people for a lot longer than you're used to being with loved ones. So I think we're all experiencing much more stress than we normally are. Yeah. And whether that translates to a mental illness or mental health disorder, or just more conflict, more irritability, more emotions in general, like that, I think that also is kind of okay. This is a time for forgiveness and empathy for your loved ones in your household, as well as for yourself. Chaplain Serna-Wallender and I have talked a lot about giving yourself grace, and we're talking about all these things that you can be doing to be more mentally healthy and to get through the holidays. And it's like, okay, I gotta journal and I gotta pray, and I need to start cooking with more gusto or something. But some days you're just not gonna have the motivation. Some days it's just, no, I'm not in a great place. Yeah. I'm not feeling it. And that's okay. That's why we have a new day, like every day, thankfully, hopefully, right? That's why we get to start over every day. And so I think it's okay to have those days too.
Our viewer questions, by the way, are blowing up. Keep them coming. Yeah, but I want to get to a few of them if we can. This one is to you, Dr. Kinkler. It says, is there a connection with isolation and stress and gaining weight? I used to exercise all the time, and now I just want to sleep or watch junk on TV. Might I be depressed? Talk to us about some of the warning signs to look for.
Yeah, so definitely a decrease in energy, and it changes in sleep if you're sleeping too much or too little. Changes in appetite and changes in weight are warning signs for depression. I will say that because of the pandemic, we aren't moving our bodies as much as we used to, and for a variety of reasons, right? And I do think that can contribute to one's overall mental health and sense of well-being. So I do think that these things are very much interconnected.
A question for the doctors, the medical doctors. Is it possible to catch COVID from someone's clothes
It's highly unlikely. It's really spread through the air, through breathing near somebody. We were really worried at the beginning that there was fomite transmission. Fomite is from surfaces. And there were some early studies done showing that they found the virus on fabric for a number of days. But what they found were sort of pieces of the viral RNA. And it doesn't really appear to be that you get it from the surfaces or get it from clothes. You get it from close contact with people, that breathing in each other's space.
Reverend, I want to talk a little bit about new opportunities. You know, I'm somebody who tries to look on the bright side of things and kind of find joy, you know, in this really kind of stressful time. And my question to you, Reverend, is would you agree with the notion that the pandemic has created new opportunities to experience things that we wouldn't normally? And I want to give a couple examples. You know, my mother-in-law, for example, is Catholic. She lives in New Mexico, but she watches a virtual mass in her favorite parish in Scottsdale, Arizona. Just earlier this week, we here at KSAT did a live stream of the Hanukkah menorah lighting. You know, these are things that perhaps maybe you wouldn't attend normally, but it's creating new opportunities, especially as it pertains to faith. Would you agree with that notion?
Wholeheartedly. I think those are phenomenal examples that this, in some ways is a year to be creative and to visit and explore, I think, again, virtually, communities and congregations and ways of celebrating that you might not be able to or have been otherwise, because things are so much more accessible from your computer, and geography doesn't mean as much anymore in this moment in time. And so thinking of this not necessarily as how it has to be every year going forward, but what is something unique and beautiful that can be done differently this year and at this time when sort of gathering like we normally would isn't safe in the same ways.
Yeah.
I think, you know, one of the things and part of our earlier conversation is there are also a number of congregations in this season who are offering like blue Christmas services, these services that are really services of mourning and sadness, and just sort of really recognizing that in this season. And so I think, you know, helping people be aware of that as ways of understanding the sadness of this time, while also thinking about, are there ways to really embrace the charitable aspects of this season, sort of to look for and act with compassion, to look around and be inspired by those in our community who are doing really beautiful acts of service and kindness and love, that we might be inspired by as well, from everyone from doing the great work at the food bank to writing letters to those in nursing homes. I think there's a lot of opportunity and space opened up for thinking anew how we care for our community.
Reverend Serna-Wallender, our church, I find myself reminiscing. I find myself being thankful for the things we used to have, and a lot of that is we do a thing where it's a virtual joys and concerns, where anybody can get on the Zoom meeting and we all just visit, and you see somebody's knitting, and you see somebody's cooking, and you see somebody's sitting out on their porch. I mean, it's a great connection that I find I really took for granted before this pandemic.
Yeah, I wholeheartedly agree with that. You know, one of the things that I've done a number of times with students is that we're no longer in the same physical space, but we are invited in some ways into each other's spaces. And sometimes what I will ask students to do is find something in your space that brings you joy and to share it with others on the Zoom call. And it's amazing the things that we wouldn't normally see, wouldn't normally get to learn about them because it's in their private space. But, Zoom has opened up an opportunity for us to sort of share some of those more intimate parts of, like, I have this thing here on my desk that really makes me smile. No one ever gets to see it, but I can share it with you right now. Yeah.
I love that. I love that. Dr. Kinkler, I want to circle back around to something that you said a little bit earlier in this live stream, and that was that we may not feel the effects of COVID until it's in our rearview mirror. If we don't address our emotions right now in the moment, and we've talked so much about seeking help if you think you need it, could that lead perhaps to a worse situation down the road if you don't deal with it in the here and now?
Yeah, that is the idea, is that when you avoid negative thoughts and feelings related to trauma, that they get bigger and bigger and bigger. And so then when you think you can avoid them forever, but really you can't. And so when it finally comes time to really dive into these thoughts and feelings, they become, it's so much harder the longer you wait, honestly.
And a follow-up question to that, for those who are suffering from a mental health disorder due to COVID, or just not even due to COVID, what does recovery look like? I mean, when we're thinking about COVID specifically, will this just go away when the pandemic goes away? I mean, what does the recovery look like for folks who are suffering?
Well, I do think that it is possible for it to just go away. Depending on how much you are able to kind of process some of what's happening for you. But what we know about, say, depression and anxiety is that it's kind of episodic. It comes and goes, and a lot of that has to do with, kind of like Dr. Plata was talking about earlier, kind of a mix of kind of like genetic predisposition or biological issues, and a environmental stressor, right? And so if the environmental stressor kind of goes away, then the expression of a mental health illness would also presumably go away. And so I do think that that's possible. But in terms of what recovery looks like if you go for treatment of a mental health disorder, I think there are a lot of different options, and there's a lot of evidence-based treatments that are based off of loads of research and have been shown to be effective. And you can really go speak with a mental health professional for something like 4 to 12 sessions and really turn your life around, and not only treat whatever depression and anxiety you're dealing with now, but also prevent that from happening again and again in the future.
We have some viewer questions. This first one I want to give to you, Dr. Serna-Wallender. It's how critical can it be if a person who has HIV or AIDS tests positive for corona?
So the good news is that if you have HIV, but you are under treatment so that you're virally suppressed, that means you don't have detectable virus, you're pretty much like anybody else that gets COVID. Now, there are other risk factors, and if you have diabetes and a few other things, that makes you more at risk of severe COVID. But HIV, if it's virally suppressed, does not make you more at risk of severe COVID. Unfortunately, if you're not virally suppressed and you have your body's immune compromised, then you are going to be at higher risk for severe disease. So that's a reason why it's actually very important to make sure that you're tested for HIV and in treatment right away, so that you can get virally suppressed, because it takes some time to get to that point. And we're actually seeing a number of new HIV cases lately. Across the country, and definitely here in San Antonio, we've had a lot of new diagnoses. And it's just really important to get folks into medical care immediately, so that you're in a better position to fight off COVID.
Dr. Allegrini, kind of staying with you, I want to read you something from the CDC, and I found this really interesting. During June 2020, U.S. adults reported considerably elevated adverse mental health conditions associated with COVID-19. Younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers reported having experienced disproportionately worse mental health outcomes, increased substance abuse, and elevated suicidal ideation. Reading that, that was alarming to me. What do you think the impact of that is on the community, public health wise?
Well, I think it's an enormous impact, and our public health efforts have been so focused on fighting COVID that, our health department, for example, and a lot of our healthcare systems have pushed other things aside because of necessity, because the focus has been on COVID. And we really need to make sure that we are addressing the mental health issues from the public health standpoint as well as from the medical care provider standpoint, because it clearly has become such a big issue. And in our clinic, we also provide mental health services for our clients, and quite a few of them have needed more attention. And so it's going to be really important for all of our healthcare systems to make sure that we're putting a very high priority on mental health during this time of COVID, because it'll impact the community overall.
Well, we're talking about this. How have things changed at the San Antonio AIDS Foundation since the pandemic? I mean, what things are you doing there? And even if it's something, like dating, that goes for anybody, whether, you're part of the LGBTQ community or not. I mean, just something like that. I mean, how has it changed?
Right. So we have a clinic and we do testing, and a lot of that's changed. We also had to go to telemedicine as well as for our mental health and our medical services. And we stopped testing for a while because a lot of the places we test are out at bars and on the strip and places where people congregate. And also because we didn't have all the PPE we needed, we couldn't test in-house. And so we actually stopped for a little while, and that was problematic. We've now shifted to curbside testing, and we have some limited testing indoors. We're testing at public places a little bit, but not nearly at the rate we were, which means we're finding we're not getting to the people as much as we need to, and that's really concerning because we want to make sure that we find folks, not just for HIV but other STIs. But also, dating is such a challenge, and it's something that at the AIDS Foundation we've been trying to work on providing educational materials. Earlier in the pandemic, especially in July, there was a lot of focus on all these young people going to bars. Why can't they just, be by themselves for a while? And, as a person who's married and has kids, I have people in my life 24/7. But for a 25-year-old living alone, that social life was their main outlet. And that's so important for your mental health. And it's not just dating, but just socializing with other people in a physical way is really important. And so we have to understand that there's a need for that. And it's important for us to discuss ways that we can reduce risk. Now, just socializing, we can reduce risk by keeping 6 feet apart, staying outside, wearing masks, etc. Dating is a little more complicated. And what I've said before is, once you decide to become intimate with somebody, they're in your bubble. And I've heard, well, you should wear a mask. Yes, you will, but eventually you're going to take that mask off, and I know you're going to take that mask off. So just accept that that person is now in your bubble, and you need to take all the precautions with them. Isolate with them or quarantine with them if you can. If that's asking a little much, try to limit the interactions you have with people outside of those in that bubble that you've created. Recognizing too that no bubble is perfectly closed. You've always got people moving in and out, but try to minimize it. And it's so important that we recognize that need for human connection. You're 25 years old, you want to go on a date, you like somebody, fortunately we have online dating, which gets us started, but sooner or later you want to meet that person. And so we just need to try to find ways to allow people to do it in as safe a way as possible. It's not going to reduce the risk to zero, but we try to make it safer.
Yeah, especially the folks who are working from home and don't get to come into an office every day like we do.
Right.
We have about 7 minutes left in this live stream, and I want to get to a couple more viewer questions. Dr. Kinkler, we had a couple back-to-back ones come in for you. One person asked, how can we encourage family members who are depressed to see a counselor? Another person asked, my husband does not believe that men should talk to a counselor, but learn to work things out on their own. How can we get someone who is depressed to get help?
Yeah, it's a really difficult question because, working on a college campus, you can imagine I have a lot of students coming to me concerned about other students and sort of like, can you drag this person into your office? The answer is no. Wow. And ultimately, what we as mental health professionals rely on a lot is that there is a model called the stages of change. And, sometimes people are sort of in this denial phase, where they just really don't see a problem. Sometimes they're more in a phase where they see a problem, but they're not ready to get help for that problem. And then they might be more along the stages of change and more like, okay, I'm going to start planning to address this issue. And so I think it's really important when you recognize someone who you believe needs help to kind of figure out where are they on that continuum. Are they in denial completely of whether they have a problem? Okay, well then that's probably not realistic to hope or expect that you're going to get them to the point where they're like actually calling a therapist. But maybe you can get them to the next stage. Maybe you can start talking a little bit more about, well, I've noticed that you seem really sad, and that it's not just kind of here and there, but it seems like it's like every day. It's been for a really long time. I'm concerned about you. It would, I really want to see you get better. And again, that you want to manage your expectations when you have a conversation like that, because you don't want to be disappointed or angry when the person ultimately doesn't say like, okay, let's make the call right now. But know that you probably have made an impact in that process just by having that conversation. And you can continue to have that conversation, maybe not, like all the time every day, because then you can push somebody in the other direction, frankly, but to be able to just be open to having a conversation about help seeking, normalizing help seeking, talking about what that process would look like, and offering support within that process. And then let that person go through that process of getting ready to make a step and to seek help, and know that when they're ready, they're going to rely on you and feel like you're a safe and comfortable person to help them through that process. And so unfortunately, it's kind of a slower process than people would like.
Yeah.
Dr. Plata, a question that a viewer sent in. How long can the virus stay in the air in a room? And do plastic separators help at restaurants and stores?
I don't trust plastic separators in restaurant indoors. We know that this virus is airborne, and we know that it can circulate wherever the air goes. So if you're sitting in between these plastic dividers and you feel a breeze, guess what? It didn't do its job. So it's definitely not a very successful way to prevent anything. It may just bring us peace of mind, but actually your risk of contracting the virus is not decreased. As much as how long it lingers in the air, so far we've been able to detect it about even up to 24 hours, if not more, within the room itself. So even on campus, when there's been a student who has tested positive and we quarantine or isolate them, we make sure that room is completely washed out and cleaned out up to the standards of the university, and we leave it fallow for about 24 hours. So we may be a little bit more stringent than what we would want to, but that's what we're doing right now.
Dr. Plata, I want to stick with you on this next question. There's been so much emphasis about the holidays. Do you believe the upcoming holidays will lead to a new or even a worse surge of COVID-19?
It depends on us, how good we are with keeping with our tight bubble. It's our homework this holiday season to keep our faith, to continue our religion and our rituals and our interactions with our loved ones, but do it in a safe manner. If you love your mom, if you love your parents or anyone near and close to you, or even just and be a good Texas neighbor, be safe out there, have a good Christmas, but make sure that you do so safely. Wear a mask if you really have to. Preferably, if you could isolate 10 days would be what the CDC guidelines would recommend. But if you really have to, most people or 75% of people develop COVID symptoms within the first 72 hours. So if you really absolutely have to interact with someone, isolate yourself for 3 days. And that means no people outside of your bubble, right? So if we don't do this homework, it's going to keep going up. It's going to climb up, and it may be the last Christmas for many of our loved ones if we don't follow these simple guidelines.
Before we leave, I want to give each of you a chance to give a closing message to the people that are out there watching, like what you want them to take away from this live stream tonight. And Dr. Plata, I'll start with you, Dr. Jose Plata with Trinity University. What do you hope people who are watching tonight take away from this conversation?
I want them to realize from this conversation to practice patience. Patience with yourself, patience with your loved ones, and patience with your neighbors. It's what's going to help us move forward and do what we're supposed to do. We're all on edge, we're all irritable, we're all anxious, depressed to a certain degree, and we're all not able to practice our faith and our spirituality like we want to. Be patient, help us on the way, and please stay safe and don't infect yourself or others.
Great message. Reverend Alex Serna-Wallender, I'll ask you the next one.
Yeah, I would say, think very similarly. The ways that we are going to honor and celebrate in the coming season are going to be different, and that's okay. And it won't be different always, but it'll be different this year, and that opens up new opportunities in space. Be creative in this moment to think about new ways of being together virtually and celebrating virtually, but also an opportunity for us to be light for each other, light for our neighbors, light pushing back against despair in this moment.
Love that. Thank you, Reverend. Dr. Sharice Rural-Allegrini, what you want viewers to take home from this?
Understanding, it's so easy to be judgmental about folks that are not wearing masks, that you think are not following precautions. You're going to see family parties, they're going to happen. So maybe trying to think, okay, how can I help them do it better? How can I help them do it safer? If they're going to have this gathering, can I bring over 10 masks and tell them to wear them, and maybe like help them set up? And it's so tempting to take the higher road and assume like, I'm doing the right thing, how come you're not? And we get very frustrated with them. Recognizing that human contact is so important. So how can we make it a safer human contact so that we can minimize the risk of COVID while still interacting with our friends and loved ones? And
finally, Dr. Lori Kinkler, your final thoughts.
Well, a part of this whole thing is isolating, and inherent in that is that you feel alone. And just know that we all feel alone. We are all alone together. And the best thing that we can do is talk to each other honestly about how hard this is, and find connection within that. And that's how we're going to get through this, I think.
Absolutely. I want to thank each of our panelists for their input tonight. I also want to thank those of you who have offered the questions through KSAT's website as well as Trinity's website. And I want to give a special recognition to some people that you haven't seen through these 3 webinars that Isis and Myra and I have done. I want to give a shout out to Lexi Salazar, especially Patrick Alvarez, and Carla Sierra with Trinity University. Yes. Thank you so much for all of your help behind the scenes in making this possible. And for those of you who are at home, thank you for taking part, and know you are certainly not alone in all we've been going through.
Yeah, and one more time, if I may, give out that number to the Texas Health and Human Services COVID-19 mental health support line. If you need help, you feel overwhelmed, you don't know where to start, call that number on your screen, 1-833-986-1919. Again, a very big thank you to everyone for watching, and to our panel of experts and guests. Thank you so much for your time.
Good night.
Thank you.